Is this a case of Asherman syndrome, subendometrial fibrosis, or chronic endometritis? This case was done with a 2-year-old primipara who is a single mother. She was worried that for some time her menstrual flow was reduced. So my clinical impression was probably Asherman's syndrome. But on the initial scan, these were what I observed. These echogenic subendometrial spots. So I thought of subendometrial fibrosis. But what is against subendometrial fibrosis is that subendometrial fibrosis affects the basal layer, not the functional layer. So this will not be responsible for the reduced menstrual flow, which is what this patient presented with. But if you look at the endometrium, it's thin. And again, if you look at this image here, you can see that the junctional zone is irregular. Somewhere here you can see regularity here. But if you come to this area, you can see hypoechoic area interrupting the junctional zone here, and another hypoechoic area here interrupting the junctional zone. I was not very sure what I was dealing with, so I suggested for saline infusion sonography. What did I find? Endometrium easily distendable, which to a large extent rule out significant Ashermans. Here you can see there are no endometrial lesions, no endometrial tissue bridging the endometrial cavity, but you can observe this thin endometrium. So this is drawing the catheter, and you can see well distended endometrium, no endometrial lesion, nothing bridging the endometrial cavity. So what are we dealing with? No longer my initial diagnosis of Asherman syndrome. So could it be the subendometrial fibrosis, which has similar pathophysiology with Asherman's, or is this a case of chronic endometritis? Thank you very much for listening.